If you've suffered with the symptoms of fibromyalgia for any period of time, inevitably you're going to ask the question, is fibromyalgia curable? Well, the good news is, although this condition seems like it is incurable, it is in fact potentially reversible. However, you're going to need a plan, and this plan is going to take some time. Understanding your condition is extremely important. You need to become comfortable with the main aspects and the anatomy of this condition. So don't be afraid of fibromyalgia. I know at first the severity of the pain is very scary and it's very frustrating. However, it is very important that calmness prevails, because anxiety will only make the pain in your sleep patterns worse. You know, people do not usually die of fibromyalgia. They often only wish that they did. So you need to learn as much as you can about all of the available self-help therapies. If you are suffering from a chronic pain syndrome, do not test the limits of the condition by over-exercising or doing tasks that you know are going to cause you more pain later. You really need to pace yourself and attempt to reduce injury and reduce pain. Do, however, try to avoid becoming a couch potato. You can begin with a good, comprehensive stretching program like our movement therapy videos. But remember, going slow is the rule of the game. You'll also need to research pain doctors to find out who is knowledgeable in the area of fibromyalgia. You know, there are a lot of fibro experts out there. Unfortunately, many of them are just good marketers. So living well with fibromyalgia is often confusing and challenging. You know, while most books promote one particular theory and one particular treatment approach, it's really important to look at the bigger picture by exploring a myriad of theories and treatment options, from conventional therapies such as medication and vitamins to alternative approaches including things like yoga and massage. Some of the unique features you'll be exposed to during the course of the information we'll provide you with include a detailed plan for getting diagnosed, including some of the tests that you might not be familiar with, that you can ask for in some cases to aid in the diagnosis, descriptions of risk factors and symptoms, and a detailed checklist that you can use to aid in your own self-evaluation and diagnosis with your physician. A patient-oriented look at the more popular and effective protocols is also something we thought was important to include. So we're going to take a look at the roles of hormonal treatments, antibiotic and antifungal treatments, dietary changes, detoxification, allergy treatment, stress reduction, lifestyle, and mind, body, and spirit changes. You'll even get detailed information on how to find and work with the right practitioners in your area, as well as receiving empathetic advice from the experts and other people who have been diagnosed with fibromyalgia on finding hope while coping with this illness. You know, living well with fibromyalgia is the end game of our efforts in presenting this material to you. So during the course of our time together, I intend to empower, reassure, and help you live well with fibromyalgia. In doing so, you're going to receive answers to some of the most frustrating questions, such as, do you need blood tests or not? What are some of the triggers? Is it stress? Is it a nutritional deficiency? Is it toxic exposure? Is it an infection? Can you ever get better? What treatments are best? Should you follow a holistic, natural, or alternative medicine approach? Or forget holistic altogether? Should you go totally conventional and take prescription antidepressants, prescription sleeping pills, and prescription pain relievers? Is it all really about an underlying endocrine or thyroid imbalance? And hormones, are they the answer? Is the solution the this or that protocol? Or is it detoxification? Is exercise helpful or harmful? What about your diet and vitamins? Could psychotherapy be the solution? Could you be dealing with a virus, a bacterial infection, a stealth pathogen? Should you have surgery, or is the real answer yoga, cranial manipulation, or even trigger point therapy? While there may not be a panacea, there are some experts who are standing out as taking risks and offering more than just the standard fare when it comes to fibromyalgia treatment. But the question remains, whom should you believe? Should you listen to your own GP, or your rheumatologist, or your internist, or your infectious disease specialist, or your chiropractor, or even your holistic MD? For those of you who are in the throes of fibromyalgia right now, take heart. There are solutions and there is help available, but you may have to go beyond medicine, and you may need to explore a new way of thinking about fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my fibromyalgia roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.